Good morning. Today I'm Professor Janvi Tandon, and I'm going to speak on healthcare delivery system and in the subcaption of healthcare in developed countries. And we would be discussing not only India, because it is in the developing stages, but developed countries, particularly healthcare delivery system in UK and US. The development team has been developed under Professor Mishra and his colleagues from Aligarh Muslim University. The learning objectives. Before we start any program, before we start any lecture, it is important to know and to define what would be our learning objectives. In other words, what we want to achieve in learning at the end of the lecture. So in this case, we would like to enumerate various challenges for the healthcare delivery amongst the developed countries. We would like to define universal health coverage. We would talk about different funding models for the universal health care, because they are not the same all over the world. They differ. And we would also like to take up the health service model for US and UK. As an introduction to this important topic, we would like to say that health delivery is challenging due to the money required, as well as various cultural, social, economic and political conditions. Now, health delivery, we have been talking about India so far, and from our Indian conditions, it becomes very apparent that health delivery, if we have to give right from the source to the person to which it has to go to, we have to take into consideration various factors which are important, which are actually working on us all the time, that is the cultural, social affairs, economic and political conditions. Because with political conditions, aims and objectives of different political parties may differ, and as such, these may or may not bring about a flow in the service conditions. More individuals suffer from non-communicable diseases, lifestyle-related diseases in the developed world than the communicable diseases amongst the developing world. However, the trend is changing, and NCDs contribute significantly also amongst the developing world in terms of disease-related indices. A word about non-communicable diseases. Today, the public, the community of different countries is actually facing problems in different lifestyles. Therefore, lifestyle is changing, it is becoming faster, money is flowing out or money is coming in, and with it, change in lifestyle is coming in. So we are going into a faster lifestyle. Our food habits are changing, our living conditions are changing, and our requirements are changing. Most important, our thoughts are changing. As a result, there are a new type of totally diseases which are now taking part and which are now coming to the forefront, rather than the diarrhea which we used to talk about in the earlier times, and the malaria and the filaria. Today we talk about obesity. We are talking about cardiovascular strokes, like strokes and cardiovascular accidents. We are talking about road accidents. We are talking about cancer of different symptoms, particularly some lung cancers, liver cancers, and we are talking about totally different psychological setup in the people. So as such, non-communicable diseases are coming, and these have to be treated in a different fashion, and the route has to be different. Now, the World Healthcare shows certain common ambiguities as shown in the World Health Report, and some of them are like inverse care, impoverishing care, fragmented and fragmenting care, unsafe care, misdirected care. What are all these points which we have been talking about? As we are talking, to continue, that all these 5 factors which are now coming into these healthcare systems and are related with the healthcare systems have to be seen to. Before we go on to describing all those, what's driving the global smart healthcare market? Now, this is something which is very interesting, because wherever you go, in whatever field of life we are talking about smartphones, we are talking about smart healthcare markets, and the smart technologies which have started coming in. So whether it is in medicines, whether it is in treatment, or whether it is in the outlook, the smart technology is there to stay, and lots of money is pouring in. And as a result, I would like to mention here that because of this introduction of smart technology and remote monitoring, many companies have started putting in money into our country, and with the result that very good hospitals and very good healthcare at the top level is now coming in. One good example is that Dubai has started putting in a lot of money for nearly 6,000 crores into Kerala market and into the Andhra Pradesh market, wherein there will be absolutely high technological hospitals who will render very good, absolute good care. Now, coming back to what is inverse care. It is very evident from the situations which we have been studying in our country or in the other countries that there is what is known as a poor population and a rich population. The poor population, who require the services more, actually utilize less of the public healthcare services, whereas the rich population requiring less healthcare services utilizes them the most. This is what we have seen in the previous lectures also. And why is this? This is because the distribution of care is uneven. Where it is most wanted and where it is the furthest, the least amount of health care reaches those people. But where it is the closest to the city population and to the urban population, healthcare is being utilized in its full richness. Impoverishing care. Now, the lack of health insurance leads to out-of-pocket expenditure for availing health services, which ultimately results in increased impoverishment amongst millions. Now, what does this mean? This means that, for example, in US people don't, some of the poorer sections don't have health insurance, and as such, if they have to have medical treatment, the entire money comes out of their pocket, and it is possible that they may even go bankrupt. So this care is in such a situation where lack of health insurance may actually impoverish the family. Fragmented and fragmenting care. This is something like your inverse care. The poor and the marginal population suffers the most, as the health services available to them are mostly uneven and disintegrated and ill-resourced. This is practically because the services are not given evenly. So some places they reach in 100%, some places where it should be to a level of 60%, it may be nearly about 25%. Unsafe care. Now, because of this hurried life, because of the hospitals becoming full, because of large number of populations attending care, hospital-acquired infections can be transmitted easily from one person to another, and even from small outdoors. Even an injection could give an infection to the patient, which he could carry it away to his house. Improper medication could be given because of lack of time, and various other preventable side effects arise as a result of poor system, contributing to poor health and death. So ultimately, it means that we have to allot proper time per patient so that whatever care we are giving is full and final, and it leads to a happy conclusion for the patient. Misdirected care. The funds allocated to the health services are mainly concentrated to curative services. Now, what is more important is not only curative services, because diseases can come and they can crop up again. So it is not curative, but what we need is funds for health promotion and primary prevention activities which can actually cause 70% reduction in the burden of disease. Universal healthcare usually refers to a healthcare system which actually will provide healthcare and financial protection to all citizens of a particular country. We can understand universal healthcare means a complete health picture for the person right from birth to death, number one, and throughout his entire system he gets a full care. But financial protection means if he is given universal health care, it means that out-of-pocket expenditures and even wasteful expenditure from the government side is prevented. So basically, it is actually a financial protection for the entire country as well as for its citizens. Universal healthcare can be maintained by three critical dimensions. That is, if we know who is going to be covered, what services are being covered, and how much of the cost is covered. This is most important because this shows the extent to which and the dimensions to which the universal healthcare will spread over for the public. The standpoint of service provision through primary and community health services works well in the ecological and social model, but in most other settings, the reality seems to be different, which provides definitely a scope of improvement. This is just a diagram of a healthcare ranking which has been seen, and these countries, for example, Australia, Canada, Germany, Netherlands. Now, we know that they are all the really well-developed countries, and they are spending quite a lot of dollars per unit for healthcare, and which we people, and this healthcare actually promotes. It depends on the quality of this. Overall ranking has actually been got from effective care, that is the quality of care, safe care, coordinated care, patient-centered care, and access for cost-related problems, timeliness of the care. So all this actually places all these countries in a higher range. Now, when we are talking about developed countries, we talk about finance. Finance is an important thing. And most important is that what are the types, we have to consider what are the types of funding models for universal health care. Universal health care, if we want to provide, it has to be from birth to death. It has to cover the entire spectrum of health diseases for the patient. And in this, there is something what is known as, say, money has to come. Money has to come from where? Now, that is the most important part. So that comes in the form of insurance. Now, insurance, now how many types? There are different types of funding models which have been seen in the European countries, and most of them are actually based either on the general taxation, and insurance comes out of that, or they could be money which is got from the user, that is the single payer or the multiple payer, and it could be from the employer. So we'll just go through these. Now, what is compulsory insurance? Compulsory insurance is provided by the government, or it is made to purchase by the residents through legislation. Now, in certain countries, it says that you have to have compulsory insurance, without which, like we said, you would be misfit for in terms of any accident or illness. So whatever the person is earning, a small percentage of it is being cut for as compulsory insurance. This goes into the general system from where the health care is being given. The problems can be overcome by implementing a single payer system or other methods that cuts the insurance agency's power. In this, we must remember that if it is a single payer, which means that different sort of agencies will not be able to come in, and they would not be able to charge differently from across individuals to ensure universal health care. So, and for example, in the funding of universal health care, healthcare costs have been going up, and US spends, in fact, US and the other developed countries are spending quite a lot of money per unit, per capita healthcare costs, and they differ from country to country. And of course, the highest is United States, and whereas in our developing countries, we are way below these, but we have to see the pros and cons as to how healthcare is being distributed to the patient. Now, in funding of universal healthcare in US, of course, most of it comes from either the state, local, or the private businesses, Most important is the federal government, which provides 27%, and households and other private agencies come in, and households means the individual payers come to 27%, and this is being funded. Now, in funding of universal healthcare UK, we are going to talk about UK and see the pattern which presents itself in UK. Basically, total healthcare expenditure was 150.6 billion pounds in 2013. They have also been increasing, and their services basically are actually from the government side only. So most of the services which are being given to the people are actually free, and this is a good thing because there each person is covered. In fact, it has been well written that even visitors can go in for free medical care and primary aid without by just showing in their credentials that they are there to stay for a few months, or so they get the full coverage. Now we come to different model, that is a single payer. The term single payer only refers, now this single payer is mostly seen in countries like Sweden and Japan and all, and the term single payer refers to single funding method. It doesn't describe the method of delivery of healthcare, it only says where the money is coming from. So mostly the owner of the fund is of course the state, but it can also be provided through a mixed system including the public and the private sectors. Now, tax-based financing. Countries like UK, Ireland, New Zealand, Spain, etc. utilize only taxes for funding of healthcare, whereas the countries having insurance-based systems arranges funds through the social security mechanism for the insurance of the poor in various forms, such as payment of medical bills directly or indirectly in the form of insurance premium payments. Now, average premium contribution for family coverage. We would like to see, this has been being seen that from 99 to 2011, the employer contributions have always been more than the worker contributions, which is in fact very sensible because the worker has a minimal pay and he has to pay in his insurance, his contribution for insurance through that. And with that, the employer tops it to nearly double. This is the system which is now being followed nearly all over in the developing as well as in the developed countries. And of course, there is social health insurance also. Now, many in today's market, contributions from workers, self-employed enterprises, government are pooled into a single or multiple funds on a compulsory basis, with these funds generated on a public-private, this is the triple P mix pattern. This is the public gives, the private gives, and the providers also mix it. And I would like to mention here that, of course, there is the private insurance. Private insurance requires payment of premiums through various individuals. This is totally private and restricted to the individual payments so that he can avail health service benefits. Of course, this differs from social insurance in terms of its voluntary nature rather than being compulsory. Now, in this, there could be people who don't want to take insurance, but for them, it would become difficult because if they fell ill, the out-of-pocket expenditure would be a far larger matter for them rather than for those who are already into this insurance, are being covered by the insurance. Now, community-based health insurance, this is a type of private health insurance where the community fund is raised from the individual member, which is then utilized in medical care need. I would like to mention here that in our country, with a special remark to India, for example, the National Health Service Scheme. National Health means the central CGHS, what is known as Central Government Health Services Scheme. This is being run in Delhi, and all the doctors who work in it and and all the people, they pay for their care. A certain amount of people or companies come into these CGHS based schemes, and through their regular payment, a small portion is being paid into this as insurance, wherein they can go at any point of time and get full health care and be reimbursed also in case it is necessary. Now, healthcare in US. Healthcare in the United States, this is a mixed type of health system in which actually 45% of the health expenses is provided by the government sources, that is local, state and federal, and private sources such as 38% from their employers and remaining 18% through out-of-pocket expense and private insurance. But it is also seen that in US, that at least 58% of the US community hospitals are actually non-profit and 21% are government owned and 21% only are made only for complete profit. So in the US you find medical, for example, Medicare, Mediaid, all these have, and then there is the veterans health care. These have all come up so that they serve the particular group or the community for which they are meant. And these people, it means that from a single payer system, it has gone into a double pay or a third category system, wherein the payer, wherein the receiver has paid, his employer has paid, and finally the government also puts in his share. The system includes firstly the single payer system, secondly mandatory individual or the employer insurance, and thirdly the consumer driven health, in which consumers mainly control accessibility. Healthcare, again in the US, most of the nation's healthcare over the past 30 years has shifted from second model to third model. The formation of universal health system is necessary for addressing the problems of increasing number of the uninsured and costs with the US healthcare system. US is the only developed nation where universal healthcare is not available, though the government is the largest health insurer in the nation. The US spends 17.9% of the GDP per year on healthcare. The Affordable Health Care Act and 2010 Patient Protection, Veterans Health Administration and the TRICARE are some of the many tax finance beneficiary programs covering 27.8% of the population. Medicare, which is a very popular insurance healthcare, Medicare covers the elderly and Medicare covers the elderly and the disabled with a historical work record. Medicaid is also available for some of the poor, and the state children's health insurance program covers children from 0 onwards and the low income families. Physician practice. However, primary care physicians presented the best return on investment for hospitals. In 2015, family physicians had an average starting salary of, this is for the US, and they are getting nearly to the tune of 1.9 lakhs, 198,000 at hospitals, and they are generating that same amount for the hospital revenue also. And it has been seen that orthopedic surgeons are very well paid and generated only 5.5 times that amount in revenue. The highest ranking physician specialists, according to the patient's online reviews of their care experience, and which means actually this is going to show what type of diseases are now becoming prevalent and are coming up, particularly in the developed nations like US. Neuromuscular skeletal specialists, thoracic surgeons, podiatrists, plastic surgeons, colon and rectal surgeons, and the lower ranking physicians are the psychiatrists, the preventive medicine specialists, the pain specialists, emergency physicians, and the neurologists. Although I feel that this we must remember, is the patient's concept of what is important for them or not. Now, health services in the UK. Created in 1948, the four public health systems in the UK are: in England, the public health system is known as the National Health Service. In Scotland, it is known as the NHS Scotland. In Wales, NHS Wales. And in Northern Ireland, it is called the Health and Social Care in Northern Ireland. The main difference between the four public health systems is the patient cost for prescriptions. Wales, Northern Ireland and Scotland have recently abolished or are in process of abolishing all prescription charges, while England, with the exception of birth control pills, which are paid for by the state, because family planning is a service which has to be given voluntarily and free to the patients, continues to charge patients who are between 18 and 60 years of old a fixed prescription fee of £7.40 per item, unless they are exempt because of certain medical conditions, and it could be Alzheimer's, cancer, or are on a very low income. In 2014, the Commonwealth Fund declared that in comparison with the healthcare systems of 10 other countries, that is Australia, Canada, France, Germany, etc., the national health systems was the most impressive overall, and it was rated as one of the best system in terms of efficacy, effective care, safe care, coordinated care, patient-centered, and cost-related problems. It also ranked second for equity. There is a point which we must remember, because as far as healthcare services in UK are concerned, basically they are totally free for the people concerned. And this comes from the taxes which are connected, and the fund is created for providing the healthcare services. Now, when you compare both the systems of UK and US, the US healthcare system sets age and income requirements, for example, for Medicaid and Medicare, on public healthcare coverage, whereas UK made public health accessible to all UK permanent residents by making it free at the point of need. The US does hold certain advantages over UK when it comes to certain private healthcare sectors. For instance, the UK rates 40% higher than the UK in percentage of men and women who survived a cancer 5 years after diagnosis. The US also ranks higher in percentage of patients diagnosed with diabetes who receive treatment within 6 months. The number of US patients who receive timely treatment for diabetes was 6 times more. So in certain cases, US is definitely better than UK, but UK is also definitely better than US because it provides free access to medicine for all. Before summarizing, I would like to mention here that when we are talking of financing and when we are talking of insurance and effective health care for all, it is important to realize that even in a country which is now shooting high in the list of technology, India has got is getting a lot of inputs from abroad. So foreign aid is becoming a very important feature, and people are rushing in to provide good technology for the surgeons and for good hospitals and for provision of basic health care or high technological care. Universal health coverage aims to reduce the various socio-cultural barriers through the provision of universal access to affordable, cost-effective, good quality health care. So basically what we talk of universal health care is that it should be the 4 pillars, that is accessible, affordable, effective and usable. Despite being a good economy country, US is the poorest performer in provision of basic health care at a reasonable cost, one of the major reasons appearing to be a lack of universal health care coverage. Because in US, it is mostly, one is patient oriented, one is disease oriented. So the universal health coverage doesn't come in, and there are definitely sections of the population who are so poor that they don't have any health care at all. Therefore, the time has come to adopt and implement universal healthcare coverage globally to help the human being lead a better quality of life. Thanks for visiting ePathshala today.